I think we are. Good afternoon. Welcome to everybody. My name is Karin Stein. I am the state organizer in Iowa for a national organization called Moms Clean Air Force. And you know that if you're watching this program because you're on the Moms Clean Air Force page. What you may not know is that we have over 1,200,000 members nationwide. And we're all moms and dads united in our fight against air pollution and also against the urgent crisis of our changing climate. And because I'm originally from Latin America, I'm an Iowa resident, I've been here for a long time, I also get to lead the Ecomadres program, which is a joint Moms Clean Air Force and Green Latinos initiative through which the programming of Moms Clean Air Force reaches Latino communities in many, many states around the country. And I will be saying some of the things I say in English in Spanish as well, so I will do that right away. Mi nombre es Karin Stein, soy la organizadora estatal de Moms Clean Air Force. Somos una organización nacional que lucha contra la contaminación ambiental y los efectos del cambio climático. Además, soy latinoamericana y estoy en Iowa a su disposición a través de un programa llamado Ecomadres, que es una iniciativa de Moms Clean Air Force y Green Latinos, y de eso podemos hablar más adelante. I would like to introduce two people who are going to join us later in the program. The first one is Molly Michael. She is project manager with our national team, and she's also an editor and just the glue that holds things together in many ways. And then Felipe Benitez, who is executive director of Corazon Latino. And Corazon Latino is hosting this coffee hour, which in Spanish we call cafecito, together with Moms Clean Air Force.
Hola.
And before we introduce our main speaker for the day, let me just take this moment to acknowledge this instant in the history of this earth. Iowa and the world is going through a pandemic, which we all have heard about and are experiencing to different degrees. The coronavirus has completely shifted everything. And I want to acknowledge that some of us are in a better position to live through this pandemic than others. And whatever subject we touch upon today that might not be directly related to the coronavirus, please by no means is meant to downplay the seriousness and the severity with which this is impacting our world. Quiero mencionar nada más, aparte de cualquier cosa de la que hablemos hoy, que en el mundo estamos viviendo la crisis del coronavirus. Esta pandemia obviamente nos afecta a todos, sin embargo, a algunos los afecta más que a otros. Y de eso vamos a hablar hoy en este programa. And it is now my honor to introduce Dr. Suzanne Bartlett. She lives in Cedar Falls, Iowa, and she practices in Webster City, Iowa. And actually both places have a significant Latino population, and this is something that she will talk about today. She is the author of not one, but two opinion pieces that appeared within 10 days in the Des Moines Register. The first one appeared on Earth Day, and in the Earth Day piece, she reflects upon the coronavirus and addresses some of the opportunities that might arise out of this difficult situation. And then just yesterday, she had another op-ed in the Des Moines Register about the terrible, terrible consequences of the coronavirus on vulnerable populations in Iowa, and that is the main topic. La doctora Bartlett vive en Cedar Rapids, sin embargo, trabaja con comunidades alrededor del área y ha tenido mucho contacto con poblaciones vulnerables dentro del contexto del coronavirus, y muy recientemente publicó dos artículos de opinión, cartas al editor que hablan acerca de esta crisis, y ella va a estar hablando acerca de esto. Dr. Bartlett, how are you today?
I am well. How about yourself?
Good. Wonderful to see you. I would like to know, first of all, before we go into our questions for the day, would you tell us a little bit about your specialty, where you have practiced, and the experiences you've had working with communities of color?
Sure. Well, my background is as an obstetrician gynecologist, and I also have studied and trained and am board certified in integrative medicine. And so integrative medicine combines conventional medicine along with alternative and complementary approaches that are evidence-based. So I spend a lot of time with my patients currently talking about all of the things that we can do to be healthy, everything from nutrition and exercise and stress management and nature to herbal medicine and things like that. So I try to incorporate a number of different things into the things I work with my patients on. So my background has taken me all kinds of places. I did my residency in Pittsburgh in an inner city hospital there, and had a very diverse patient population when I was there. I moved back to Iowa, and although the predominant population in Iowa is Caucasian, I have cared for a number of patients who are people of color in a number of different practices. So I've worked both in Waterloo and Cedar Rapids, and now, as you mentioned, I'm seeing patients in Webster City. So I've been in Waverly, Iowa. So I've practiced in a number of different patients throughout the state of Iowa.
La doctora Bartlett explica que ella ella es médica obstetra y además se especializa en algo muy importante e interesante, de lo cual ella nos hablará después, que es medicina integral, que toma en cuenta muchos elementos que sirven para el tratamiento médico de los seres humanos, que no necesariamente son parte de la medicina tradicional occidental. Y ella en un momento nos hablará de esto. Ha tenido mucha experiencia trabajando con comunidades muy diversas, tanto aquí en Iowa como en Pensilvania. Did you say Pittsburgh? Am I? Okay, sí. En el área de Pittsburgh. Let's pick up on that. Your contrast between Iowa and the work that you did in Pennsylvania. What are some of the similarities and differences that you have observed in how diseases, and if you want to start talking about the coronavirus, how they might affect and play out differently in very urban areas versus our more rural state?
Right. Well, as we know, urban areas are being affected heavily because of with the coronavirus. Every place from Wuhan, China, where it has originated, where people were pretty compactly living, to, as we've seen, New York City and then other urban areas around the world. And we know that the coronavirus passes very easily from person to person if two people or a number of people are in close proximity to each other, which is precisely why we've talked about the 6 feet of distance between people and social distancing. And I don't know if you want me to pause so you can translate.
Yeah, that sounds great. Le pregunté a la doctora Bartlett que nos hable un poquito acerca de las similitudes y diferencias entre cómo las enfermedades, como por ejemplo el coronavirus, que es el enfoque de nuestra conversación hoy, de nuestro cafecito, las diferencias y las similitudes entre cómo esto se expresa y cómo se transmite en zonas urbanas y zonas rurales. Ella explica que en zonas urbanas uno de los graves problemas con el coronavirus es justamente la agresividad con la cual se transmite el virus, y la proximidad de la gente en las zonas urbanas presenta un reto enorme. Over to you.
All right. So one might think, and I think a lot of people here in Iowa expected that the coronavirus would not affect us here, that we might in some way be immune to it because we don't live as tightly compacted as people in urban areas. And all along, I have been concerned that attitude might get us into trouble, and it truly has.
Y una de las cosas que ella expresa en este momento es que en las zonas rurales como la nuestra, la gente ha tenido una falsa sensación de seguridad. Y ella viene muy preocupada al respecto desde hace buen tiempo, y porque en realidad es eso, es una seguridad falsa, no es una seguridad real de que aquí no se va a transmitir simplemente porque no estamos aglutinados. Off to you.
And so certainly the patient population that I see is different here, but where I practice currently in Webster City, about 20% of my patients are Latino.
En este momento donde ella trabaja, ella tiene más o menos el 20% de sus pacientes que son latinoamericanos.
And something that I've talked about in both my recent op-ed piece and in a number of other conversations is the fact that I've witnessed over the past few years in my practice that people in rural Iowa are some of the least healthy patients that I've cared for, honestly, over my career that has spanned about 20 years at this time. Not just my patients of color, most, certainly, and not necessarily only my Latino patients by any means, but patients in rural Iowa do have a number of chronic health diseases that predispose them to coming down with the coronavirus.
Felipe, te voy a pedir por favor que traduzcas esto porque estoy teniendo un pequeño problema. I would like Felipe to just step in and translate this last section.
Claro, ahora sí ya estoy. Suzanne estaba comentando que el 20% de la población o de los pacientes que ella trata son de origen latino. Y Suzanne, you were mentioning that there's a big, you're starting to see a transmission. Sorry, just missed one part, but 20% of your
about 20% of our clinic population where I currently practice is felt to likely be Latino, whereas our state population of Latino people is about 6.2% according to the last census.
Dr. Bartlett, I understand that the COVID figures are similar. In other words, that there are about 6.2% Latino-Americanos or people of Latin origin in general, first generation or older generations in Iowa, and that the COVID, people being affected by COVID also stands at 20, but is rising. Let me ask you about something that you wrote. La doctora está diciendo que más o menos en el estado de Iowa somos 6.2% de latinos, sin embargo, 20% de los pacientes que ella ve por enfermedades de todo tipo son latinoamericanos. Es decir, hay una desproporción entre la cantidad de latinos que vivimos en Iowa y la cantidad de latinos que buscamos atención médica. Y esta desproporción existe también con relación al coronavirus. Let me read something from your op-ed that you published, that was published yesterday in the Des Moines Register. I quote, "Non-white people are sicker and more likely to die than white people." Could you expand upon that?
Yeah, unfortunately, we don't know why officially because this virus is so new. This is something that has, I will admit, surprised me and a number of my colleagues right off the bat, that we thought this would be devastating across the board to all people. And yet here we are once again seeing a disparity in the people who are becoming sick from this disease.
Would you reflect, would you reflect on the reasons behind this that you might be able to think about while I translate this? Ella expresa que en realidad está sorprendida de una manera seria que esta desproporción, porque pensábamos que el coronavirus afectaría a todos más o menos por igual, sin embargo ella sigue viendo esta desproporción con respecto a latinoamericanos y también la población afroamericana. Would you say the same is true for the African American population? There's this disproportionate expression.
Yes, definitely.
Lo mismo sucede en esa población, en ese segmento de la población. Entonces vamos a escuchar cuáles son las razones. What do you think is causing this disparity right now in the midst of coronavirus?
I think we can start at the most basic reasons why this happens. And we can start with things like nutrition. And we can start with income if we back up even further. And we know that there are disparities in wealth, of course, in this country and in this state. And so that people who are unable to buy healthier food start off with poorer nutrition right off the bat. So that would be thing number one, I would say, is start with wealth, look at nutrition, and go from there.
Entonces, el primer factor o los primeros dos factores que ella señala, como abriendo el contexto, echémonos para atrás un poquito y miremos el contexto general. Muchas de estas personas empiezan en desventaja porque tienen menos ingreso que muchos otros y a razón de esto, muy posiblemente su dieta sea menos saludable, menos balanceada, lo cual los predispone.
So we start with nutrition, we start with money. we start with where people work. If people are more likely to work in a place that is highly concentrated full of people, for example, the meat packing plants here in Iowa, where we're seeing enormous surges in number of patients with COVID, people are too close together, just as we were talking a moment ago. If you're having to work shoulder to shoulder next to somebody else on an assembly line, you're much more likely to contract the virus than if you're able to spread out at your place of work.
Luego, el siguiente factor fundamental que está teniendo obviamente secuelas tremendas en Iowa es el tipo de trabajo que realizan las personas de bajos ingresos, que muchas veces son situaciones no saludables, y esto lo estamos viendo de manera extrema en este momento en las plantas de procesamiento de carne y otros productos, en donde las personas están trabajando codo a codo, espalda a espalda, y ha habido poco distanciamiento, que es absolutamente esencial para este virus.
Right. And then in these meat packing plants and similar industries, we know that people did not have adequate protective equipment, personal protective equipment right off the bat. We also know that there are language barriers. So people might not even be aware that this infection is spreading. They might not be able to read the signs that tell them what they need to be doing to avoid the virus.
Otro factor muy importante que señala la doctora Bartlett es en términos de comunicación, que no necesariamente toda la información ha sido fácilmente accesible. Let me just comment on this, if I may, Dr.
Absolutely.
Bartlett. I have many professional colleagues who are fellow Latinos here in Iowa and work for the government and in nonprofits and private clinics. And this has been something that's been echoed with a sense of desperation here, that Latinos, there isn't enough material, hasn't been, not from the beginning, for Latinos. And add that onto the slowness with which our local government has acted on the coronavirus, has really created devastation in the Latino community. The president of LULAC, the Latin American, Felipe, do you have it on hand? The LULAC, what the acronym stands for?
The Union, the League of United Latin America Citizens.
Exactly. And our local president has been appalled by this and reached out to the media about the fact that Latinos in Iowa from the very beginning have been at a disadvantage because the information was not easily available in Spanish, and still really isn't if we talk about the state of Iowa. At no point has the government, as far as I have seen, issued requests that these things be translated massively, any kind of safety information. I have seen the Department of Public Health has had for a long time publications available in Spanish and English, and I have directed people who have asked me to the Department of Public Health. But the government, the governor and the state government of Iowa has not reached out to Latinos sufficiently. An argument was made that we are an English-only state, but actually that may be true, but that's true for things that, schools the primary language would be English with some exceptions, but that legislation does not preclude and does not exonerate the state of Iowa from the responsibility to publish things in Spanish if such a proportion of the workforce is in Spanish. So I just thought I would expand upon this comment that you made, Dr. Bartlett, because that is certainly a huge concern for Moms Clean Air Force in Iowa, is the accessibility to the information.
Absolutely, yeah. And then you add in accessibility to healthcare at all, plus potentially not having access to sick days or time off of work without pay or even with pay.
Well, the governor made it clear that if you don't show up for work at these meat packing plants because you're afraid for your health, you will lose the unemployment benefit.
Yes. Fortunately, I've been seeing some legal action potentially about that. So hopefully people will be able to access legal aid if that becomes an issue for them.
Mm-hmm. La doctora también expresa el factor de acceso a cuidado médico. Muchas personas, justamente las más afectadas, no necesariamente tienen el dinero o los recursos para obtener la atención médica necesaria en cualquier situación. Y en este momento muchos se han afectado por normativas que les dan en el trabajo, en donde están bajo mucha presión de trabajar y no tomarse tiempo libre. Esto está cambiando, pero realmente ha cambiado muy lentamente. By the way, anybody who's listening should be able to type in comments and questions. Our representative from the national office, Molly and Felipe, will be paying attention to these and will be sharing them a little bit farther on. Dr. Bartlett, tell us a little bit about recommendations you can give to families in general, Latinos and non-Latinos,
Right.
about ways to bolster their health.
Absolutely. Yeah, and as we mentioned at the beginning, we knew all along that people would be at increased risk for contracting the virus if they had underlying health conditions. And way back in February, I had written a blog article to this effect that we need to be aware that if you have things like high blood pressure, type 2 or type 1 diabetes, if you have obesity or liver or kidney problems or asthma or any kind of lung problems, and smokers, and all of these things put people at increased risk for developing the virus.
I'll make a translation here.
Sure, yeah.
La doctora, ¿qué podemos hacer para mejorar nuestra condición de salud y optimizar la manera en que podemos defendernos naturalmente contra el virus, aparte de tomar todas las precauciones que se recomiendan? Ella menciona que en marzo escribió un artículo que seguramente nos puede dar la referencia acerca de los factores que ya conocemos que empeora la susceptibilidad de un individuo, de una persona ante el coronavirus, ante cualquier enfermedad, pero no sobra repetirlos. Por ejemplo, el sobrepeso, la diabetes, el fumar, es vivir en zonas contaminadas. Todos estos son factores que predisponen a algunas personas más que a otras.
Thank you. So one might think, well, I have one of those conditions, or I have several of those conditions, therefore I'm just a sitting duck for this disease. And I wanted to make the point even a couple of months ago that that's certainly not the case. There are always things that we can do to improve our health, and we can still today in May do things to reduce our risk of contracting the coronavirus. If you want to translate that.
Positivas, sorry for interrupting. Una de las cosas positivas y muy importantes que acaba de decir la doctora Bartlett es que si un individuo, una persona, un hombre, una mujer, un niño, piensa que porque ya tiene diabetes o porque ya tiene sobrepeso o porque vive en una zona contaminada, de pronto siente que ya está a la merced de la enfermedad y es cuestión de que si le toque o no le toque. Sin embargo, la doctora quiere recalcar que todavía, aún así y aún ahora, a esta altura, en mayo, con la enfermedad a todo dar en Iowa, hay cosas que podemos hacer para mejorar y protegernos en términos de salud.
Right. So we've been hearing about things that we should be doing. We should practice careful hand washing or using hand sanitizer regularly. You've heard recently about wearing a mask and how important that has turned out to be. And so those are the things that we talk about all the time. And we can stand, at greater than 6 feet apart, and we can try not to congregate in social gatherings and all of these things that you've been hearing about. But there are certainly a number of other things. So you can translate that.
Sure. Obviamente lo que se nos ha dicho, es decir, mantener una distancia de por lo menos 6 pies, que vienen a ser 1.5 metros, portar una máscara, llevar guantes, lavarnos las manos repetidamente varias veces al día, si es necesario usar un sanitizer, que no me acuerdo en este momento cómo se llama, Felipe, si tú te acuerdas me ayudas, pero todas estas...
Desinfectante de manos.
¿Qué dices?
Desinfectante de manos.
Obviamente. So, obviamente esas son cosas que debemos hacer. Sin embargo, vayámonos más allá porque la doctora se especializa en una visión más amplia de la medicina, como lo decía yo en la introducción. Entonces, permitamos que la doctora explique qué podemos hacer más allá de esas medidas inmediatas.
So there are other things that we can do to bolster our immune system, and they start with things as simple as what we eat. And if we give our bodies the building blocks to boost our immune cells, then we're set. So we hear all the time about the importance of eating fresh vegetables and fruits. If you can't buy fresh, then by all means use frozen, use canned, whatever you can do to be increasing your vegetables, which give you antioxidants, which specifically work to help fight infections. So starting with what you eat.
Una de las cosas más importantes que se puede hacer es comer bien, y ella indica que, por ejemplo, los vegetales, que son fuentes de antioxidantes importantes, y los antioxidantes nos ayudan, mejoran nuestro sistema inmune y nos ayudan a defendernos contra enfermedades graves. De cualquier forma, vegetales frescos, si no tiene vegetales frescos, entonces congelados, si no los consigue congelados, entonces en latas, pero vegetales y vegetales y vegetales.
See, and we want to see if we can try to reduce our intake of processed food and fast food, because the foods and the chemicals that come in processed food we know cause inflammation, and if your body is dealing with inflammation, then there's no way that it is set up to fight infection.
Give us a few more examples of processed foods, because that is a term that some people have heard and may not know what it looks like.
I know, it's
But what else?
Really, if it comes in a box or a bag, it's processed. So if it has ingredients beyond, especially ingredients that you can't pronounce, then it is processed. And unfortunately, we've become a society of processed food eating people out of convenience, because people are busy and it's easily accessible and quick. And it's absolutely contributing to the obesity rates, absolutely contributing to type 2 diabetes and high blood pressure, and really all of the conditions that predispose us to being at higher risk for the coronavirus.
En términos de dieta, recalca la doctora Bartlett que es muy importante evitar los alimentos procesados. Los alimentos procesados son básicamente fácil de describir. Si vienen en una caja, si vienen en un paquete, en una bolsa, preempacados, son procesados. Las comidas también que le llamamos chatarra en América Latina, es decir, lo que compramos pasando rápidamente cuando estamos apurados, pasamos rápidamente no voy a mencionar las compañías, pero pasar rápidamente a comprar algo que ya esté preparado. Muchas de esas comidas son procesadas. Si contienen ingredientes que no puede pronunciar, téngalo por seguro que son procesadas. Quiero agregar algo que la doctora Bartlett no dijo, pero yo creo que ella estaría de acuerdo. Básicamente, comamos como comía nuestra abuela y como comía nuestra mamá. Es decir, mi mamá y mi abuela. Quizás si tú tienes 12 años, entonces no. Pero básicamente las señoras consiguen, y muchas veces en nuestros países de origen todavía es el caso, consiguen los ingredientes primarios y arman la comida en la cocina y agregan su sal y sus especias y no abren un paquete para alimentarnos.
So as you said, if your grandmother made it, that's what you would eat, right? Something to that effect?
Exactly. Yeah. I mean, basically, if we cook again like our grandmother did, or grandfather, less likely, but grandmother, then that is what we want. Basically, the point being, you take primary ingredients and put them together. They're not put together for you.
That's
Any
right.
other things we can do for our health in these tough times?
Absolutely. Exercise. Exercise is one of the most important things that we can do for our health to boost our immune system. Just moving, getting outside and moving in any way, even if it's walking, trying to get 10,000 steps per day is good for us. There are all kinds of studies that have found that helps the immune system, helps us to reduce inflammation, helps with all of those chronic conditions too.
Ejercicio, ya ustedes sabían que eso venía, ¿verdad? El ejercicio es muy, muy importante. Por ejemplo, un promedio de 10,000 pasos al día. Eso podría sonar extraordinario, pero los 10,000 pasos son que milla y media, 1.5 miles is roughly 10,000 or...
It's a little more than that, but...
More. Okay. Start with 1.5 miles.
Absolutely.
Caminar, simplemente moverse es una de las, y al aire libre, ojalá. So what do we do if we're in a neighborhood with lots of other people? I assume we can still aim to be outside and just keep our distance.
Right now, it depends where you are and what the regulations are, where you are. If it's safe to do so and it's not against any order currently, then I still recommend getting outside and walking. Right before I got on this video, I took a quick mile walk around the block just to clear my mind and get outdoors. And I just think if we can do that, if we can safely do that and keep social distancing and it's not breaking any laws, then by all means do that as many times a day as possible.
Entonces, por favor, ejercítense, muévanse, salgan, obviamente respetando las normativas de seguridad, pero hay maneras de hacerlo y el aire libre es muy, muy beneficioso.
Mm-hmm. I think it's really important to emphasize sleep. If we're not getting adequate sleep, our body doesn't have a chance to recharge. I'm sure everyone can think of a time when they felt like they were coming down with a cold and probably were under a lot of stress and maybe hadn't been sleeping well. I know that if I feel like I'm coming down with something, if I go to bed, there's a good chance I'll wake up the next morning and have beaten it. So sleep is one of the absolute best things we can do to keep our immune system healthy.
Ah, me imagino que entendieron que algo que es fundamentalmente importante para esto es dormir lo suficiente. Muchas veces uno siente que está resfriándose y si uno logra dormir una buena cantidad de horas, uno se despierta muchas veces sin ese resfrío. O sea, el sueño, realmente conciliar el sueño que uno necesite, que en average, at least 7 hours?
It's actually recommended. There are a number of studies looking at different parts of the body and the benefits of X number of hours of sleep, and they all seem to center around the magic hour of 8 hours of sleep.
Ella recomienda, en base a muchos estudios que todos vienen a dar los mismos resultados, que la cifra mágica son las 8 horas al día. Now, I have trouble sleeping, unless I'm sick, Dr. Bartlett. I have a lot of trouble sleeping for 8 hours. But I nap as much as I can, quick naps, power naps. Is this also a good way to kind of bolster one's immune system?
Sure, absolutely. Those little 20-minute power naps can be very effective. So, yeah.
Las siestas también tienen un buen efecto. Any other thoughts about what we can do at home now under these difficult circumstances?
Well, I could go on and on and on, of course, but I think anything we can do to manage stress. This is a very, very stressful time for everybody. People are stuck inside with too many people in one space, and people are worried about income, and so stress is an enormous problem right now. So I think anything that we can do to manage stress, whether it's a quiet time to meditate or prayer or whatever it is that works for you, even simple breathing techniques can be so effective. And there are links to those on various websites. I teach them to my patients all the time. And I'll talk about nature next, but if you want to go ahead and mention those things about stress and meditation and whatever it is that helps you to kind of decompress, I think there's been no more important time in the world than right now to dust off those practices and put them to use.
La doctora señala además el manejo de las tensiones, de las ansiedades, lo que llamamos comúnmente estrés. Poner la atención a eso, escuchar nuestro nivel de estrés y manejarlo de la mejor manera que nos sirva a cada uno. Puede ser la meditación, puede ser la religión, puede ser escuchar algo, puede ser, qué sé yo, salir a caminar. O sea, lo que a mí me desestresa va a ser diferente a lo que le ayuda a usted a desestresarse. Pero póngale atención porque mucha gente amontonada en la casa las 24 horas al día es un cambio grande. Entonces, el estrés también es un factor que debemos cuidar. Dr. Bartlett, let me go back out a little bit again and look more because I want to return to nature. I want to end up on that note, but I would like to back up a little bit and go back to what's happening at the legislative level. Let's stay in Iowa for just a minute, because this is also in part a resource for our listeners, for our audience. we have in Iowa 4 representatives and 2 senators. These are people who are in Washington, D.C., helping Iowans lead better lives in many ways. That is their job. They are there to represent us. And I see a difference among them and how they respond. And I just want to let you know, though, that no matter how they respond, they are there for you. And if you have concerns about things you see in your community, for example, I saw that our Representative Axney and Finkenauer, both representatives, have on their Facebook pages published statements about their concern regarding minority workers in the factories. They want the legislature to pay attention to this at a national level. They're pointing out the grave situation of not protecting the workers that are growing, or in this case, processing our foods. So please reach out to them. Por favor, quiero señalar de que tenemos representantes en Iowa y tenemos senadores en Iowa, 4 representantes y 2 senadores. Tienen sus diferencias políticas, sin embargo, su trabajo es representarnos. Quiero decir que hay algunos latinoamericanos que por razones culturales sienten que otros se encarguen. Es más, estamos un poquito predispuestos a dejar que los expertos se encarguen de lo que nos afecte. Sin embargo, eso es una gran falacia. Nosotros somos los mejores portavoces para lo que sucede en nuestras familias, en nuestras comunidades. Y los representantes son las personas que deben escuchar lo que nos preocupa y también los que deben escuchar si hay algo que agradecer. Por ejemplo, la representante Finkenauer y la representante Axney, ambas tienen en sus páginas de Facebook, y por favor realmente los animo a que busquen esta información y se familiaricen un poco con nuestros legisladores. Las dos tienen en su Facebook, han publicado pronunciamientos en los que piden que el Congreso de los Estados Unidos tome un papel más proactivo en cuanto a la protección de los mismos latinos que están trabajando para mantener la producción alimenticia rodando. Ellas están muy conscientes de lo que está pasando con los latinos. If I go to Senator Grassley's page, all our legislators have been continuously talking about COVID, sorry, and taking this extremely seriously. It's just that their angles, their concerns are a little bit different. So Senator Grassley has been wonderful about reaching out to farmers. I see less in what he has published in terms of being worried about the very people who work to process the products. And might I add, it's when we talk about farmers, it's not, most of the meat produced in Iowa is not produced on the traditional farms that we might think about. Most meat produced in Iowa are produced in confined animal feeding operations, or CAFOs. These are factory farms. So it's when our legislators talk about protecting the farmers, they're not necessarily talking about protecting family farmers. They're protecting large industries that right now, under the coronavirus, the coronavirus has revealed the weakness in our industrial food system. Because we're producing all this meat, but there isn't a simple way to bring it to the regular outlets in communities where the meat could be used. Our governor is talking about, by all means, let's not euthanize cattle and pigs. I agree. I'm a farmer's daughter. I'm an animal lover. I agree. It's terrible what's happening. But let's also pause for a moment and think about what this means. The crisis in animal processing and what that means to the owners of the processing plants and to the workers in the processing plants who are experiencing the health effects are pointing to a weak link in the system that, by the way, also happens to be very polluting.
Absolutely.
Moms Clean Air Force, we're very concerned about pollution. So our legislators have different views on exactly which angle to take. Nuestros legisladores tienen diferentes ángulos con los cuales ellos ven la producción de la comida. Y este es un tema que me gustaría cubrirlo en un cafecito para hablar con ustedes. ¿Qué pueden hacer los latinos para comunicarse con sus legisladores? Y realmente lo pueden hacer todos, porque los legisladores no son policías. Ellos no tienen potestad policial. Si ustedes van a hablar con legisladores y su condición legal en este país está todavía en proceso, no los descalifica. Ellos siguen siendo las personas que abogan por nosotros y Moms Clean Air Force en Iowa les puede ayudar. Okay, I just wanted to reach out to Latinos in Iowa and let them know that their representatives, their elected officials work for them. They're not policemen. They're not police women. Any immigrant has access, and Moms Clean Air Force in Iowa can help them with access to legislators. Wonderful. I just want to make that sure that's understood and we can help them. But let's turn back to this industrial system. What are the problems that you see with that, Dr. Bartlett?
It is such a system-wide problem, isn't it? You know, it's everything from, we talked about being disconnected from our food that we buy at the grocery store, where we don't even know the names of the ingredients on the food that we're putting into our mouths. And so the same thing applies to the food that is arriving from somewhere, from some farm, from some factory, from some meat packing plant. And we're just so disconnected from where our food comes from and what it is. And as you mentioned, the effect that all of that food, all of that livestock is having on our air and greenhouse gas effect and all of that. I mean, it's a monumental problem that we could talk about for hours and hours and hours.
Yeah, la doctora recalca lo que yo discutí en inglés, lo que presenté en inglés, que la manera en que producimos gran parte de lo que comemos está totalmente desconectada un elemento del otro. La manera en que se produce nuestra comida, muchas personas no saben cómo se produce y todo el sistema no es integral, es decir, la comida, los animales se crían en fábricas, la carne se procesa en otras fábricas, llega al supermercado. Y todo el proceso, desde la producción de los alimentos hasta el momento de ingerirlos, hay unos desconectes tremendos que han causado un problema en el sistema alimentario, que además, por cierto, ahora estas debilidades se ven expresadas a través de la crisis del coronavirus. Dr. Bartlett, at the national level, we're seeing alarming deregulation of environmental legislation. Secretary Andrew Wheeler at the EPA has basically gutted our tailpipe pollution standards. He's issued under the coronavirus circumstances, he's issued waivers for the very industry that we're talking about. His proposed standards for particle pollution are just too weak. There is this PM 2.5 standard, which the particles are so small that they can filter, please correct me if I'm wrong, they can filter from the lungs into the bloodstream and cause inflammation problems, which in turn undermines our ability to fight disease such as the coronavirus. What's terribly alarming to us at Moms Clean Air Force, in addition to all of these things, is how scientific information is being handpicked in this decision-making. Another example of what's happening at the EPA right now is the weakening of the mercury standards, which you might agree if these are, mercury is spewed out tremendously in industrial cities or anywhere where we have energy produced by coal-fired plants. How does this national regulation affect people in Iowa in their ability to fight the coronavirus?
Well, I mean, you probably have more statistics at the tip of your fingers than I do about Iowa. But one of the main reasons I decided to study integrative medicine was because of environmental toxins and what they do to the human body. And it's everything from the air we breathe in Iowa, which is full of chemicals. It's the water that is polluted by chemicals, farming runoff and things. And I'm extremely concerned about that. I'm extremely concerned about the chemicals that are poured on our food that we eat, the pesticides and the herbicides that our food is drowned in. And regardless of what we eat, essentially it's going up the food chain. I always tell people we are what we eat, and we are what we eat eats. And so we need to realize that these chemicals are affecting us enormously. Everything from plastic and BPA that's in cans and that lines our canned food and things, to, again, these chemicals that are everywhere that we know are endocrine disrupting compounds. We know that they're cancer causing. We know that they affect our immune system negatively. So anything that we can do to reduce our exposure to environmental toxins is going to help us in the face of this virus.
Which leads me to think that speaking up is super important.
Absolutely.
At the national level, these standards are being weakened.
Right.
Who is going to bear the consequences? But the people who are most vulnerable in the most vulnerable locations, and then the future generations. Una de las cosas que hablaba con la doctora es lo que está sucediendo a nivel nacional en el EPA, que es la agencia que supuestamente protege las normativas ambientales, pero bajo el actual administrador, Andrew Wheeler, muchas de estas normativas se están debilitando. Y la doctora explica que esto obviamente tiene consecuencias, porque en Iowa, por ejemplo, quizás nuestra preocupación principal sea los químicos que inhalamos en el aire o las cosas que se fumigan en lo que comemos. A nivel nacional hay otras localidades donde otro tipo de contaminación puede ser más prevalente, pero cualquier legislación a nivel nacional que no se proteja nos va a afectar, y sobre todo a los más vulnerables. Ella explica que estos componentes afectan el sistema endocrino de las personas, y con ello las personas tienen una desventaja a la hora de protegerse contra el coronavirus, por ejemplo. Entonces, muy importante alzar la voz, y Moms Clean Air Force les puede ayudar con ello. Por favor, contáctenos. Al final de esta presentación, en unos minutos, voy a dejar la pantalla colocada con mi información de contacto, porque realmente podemos hacer mucho en términos de asegurarnos de que nuestro gobierno realmente nos proteja. I would like to turn anything, I'll return to you, Dr. Bartlett, but anything you would like to conclude with, you may think about at this moment. I would like to turn to our national team members. Felipe and Molly, have any questions come, any comments? Would you like to make comments? This is a great moment.
Actually, we've been getting a lot of thank yous, a lot of love from Michigan, West Virginia, but people have been a little bit shy and commenting.
That's all right.
We still have Dr. Bartlett, because let me tell you, she is going to be big time. I'm just telling you. But I do want to make a quick comment and get your reaction, Susie. She's my good friend. Sorry if I'm not as respectful as I should be with Dr. Bartlett.
All good.
But I think it's important to mention that this is what's happening in Iowa. It's a cautionary tale. I think I remember a few weeks ago when this was starting, I remember reading, because I follow Susan's Facebook and her social media, saying like, what's going on? What's wrong with people? Folks here in Iowa think that this is not going to happen, that this is just something happening in New York or elsewhere and in every level. And what we're seeing is that, yes, at this point, we may be seeing the effects on communities of color, but the virus is not discriminating or not choosing. It's going, I mean, it's just who's getting it first. But ultimately, I think it's not a matter of when or if, but it's a matter of when. And so I think it's a cautionary tale for other communities, other places where there may be similar circumstances, where decision makers at policy level or at government level may be making decisions that might not be the right ones. So Susan, I would love to hear a little bit about it, because I remember you were pulling your hair like, oh my God, what is wrong with these people? Why aren't they paying attention? And now we're seeing, unfortunately, the consequences.
We are seeing it, and unfortunately, there are still all kinds of people who are not following social distancing recommendations. I see it every single day. It's very frustrating, and I think there still is often a sense that I don't know these people. I don't know these people who are in the hospital. They're just numbers, and I haven't been personally affected. And it's sad that it would have to come to that before people would take something like this seriously, because this virus, when all is said and done, does not discriminate. Sure, some people are more able to hold themselves up in their homes and protect themselves, but it's a very highly contagious virus, and unfortunately, it's going to be here for a long time. I think that's the other thing that is worth mentioning, and I think there have been all these hopes that it would be gone in the summer. There's a hope that we'll get a vaccine or we'll get medications, and these things will happen, but they will happen in time. And frankly, even if there is a vaccine, it's still going to take quite a bit of time to roll it out to people and for immunity to occur. And this is not something that's going to be over quickly. And I think we need to accept that on some level and continue to do what we can to stay safe.
Felipe, ¿tú quieres ser tu propio traductor?
Se me olvidó que había traducido. Bueno, yo lo que estaba comentando era que, bueno, en conversaciones con la doctora Bartlett, muy al inicio de cuando la pandemia estaba llegando a Estados Unidos y en Nueva York, que ella mencionaba en sus redes sociales, en comentarios, en pláticas que hemos tenido, que en Iowa las personas creían que esto no iba a llegar, que esto era algo alejado, que esto no les iba a pasar en Iowa. Y obviamente eso no fue la realidad. La situación es que está llegando y va a llegar a todas partes. Y bueno, es lo que se llama ahora sí que una fábula de prevención. Es decir, miren lo que pasó aquí.
Ah, ¿no?
Perdóname.
Moraleja, casi.
Moraleja, exactamente. Miren lo que nos pasó aquí. Y la doctora Bartlett respondió, o lo que nos contestó es acerca de que sí, en realidad ese es el gran problema, y que no hubo esa preparación, que no hubo y que todavía no existe. Mucha gente lo toma todavía a la ligera, que es algo que a lo mejor no te está pasando, o no lo estás viviendo en tu familia o en tu círculo inmediato, pero va a pasar. Y lo importante también es, ya se me fue la otra parte, es decir, que el virus no se va a ir. Desafortunadamente, a pesar de que hay avances en la creación de una vacuna o de un tratamiento, va a tardar. Así que tenemos que acostumbrarnos que es la nueva realidad, que este virus no se va a ir y que tenemos que tomarlo en serio, no solo por el bienestar de nuestras familias, de nosotros mismos y de nuestras comunidades. Como un poquito de libertades creativas, pero te lo dejo a ti.
No, y además otro punto importante que recalca la doctora Bartlett es que dice quizás algunas personas no ven las personas que se han enfermado, porque muchos en el estado de Iowa han sido latinos y también personas mayores. Entonces, los latinos que trabajan en las fábricas, no todos los vemos. Las personas mayores que están en sus residencias comunales, comunitarias para adultos mayores, no necesariamente los vemos. Entonces creemos, no nos va a pasar. Sin embargo, este virus es tan altamente contagioso que fácilmente se brinca de estas concentraciones en donde los estamos viendo ahora en este momento en Iowa. Por cierto, Iowa se ha convertido correct me if I'm wrong, Dr. Bartlett, Iowa is now #1 in the speed of coronavirus contagion. How do you say that?
Honestly, I'm not sure, but as fast, the rate at which it is
among the fastest. I mean,
among the fastest within the top 4, I believe.
It's incredible. And unfortunately, how it's handled by a government plays out.
Certainly does.
That is what we're seeing here. Entonces, el hecho de que no veamos a los pacientes no significa que no nos va a dar. Iowa está apenas empezando y este virus se brinca. El brinco va de los focos donde se encuentra en este momento y se va esparciendo dentro de la población más amplia. Molly, do you have any thoughts or comments or anything that you would like to ask, contribute?
Yes, as soon as I can find the unmute button. Actually, I simply wanted to thank you both. for shining a light on a lot of these issues in Iowa. I know often, I was born in Dubuque, Iowa, of all places. And I think that oftentimes Iowa is thought of as this beautiful, rich, clean, unpolluted farmland, agricultural community. And it is all of those things, but it's also full of coal-fired power plants. And there are also lots of other industries that contribute to air pollution and the climate crisis. And those are the kinds of things that I appreciate having this conversation centered around a state like Iowa, where people like me who live in Philadelphia don't always think about Iowa as being a place where people need strong protections from air pollution and strong public health officials and strong physicians and medical providers like you, Dr. Bartlett. So I am just saying thank you on behalf of Moms Clean Air Force for the work that you're both doing in Iowa, because it's such an important place. And Karin, I think you can translate, and then I think you wanted to bring us back into a closing and talk about nature and all of the things that.
Correct, that's right, thank you. Molly Michael de la Oficina Nacional de Moms Clean Air Force, Molly Michael y Felipe Benítez de Corazón Latino son nuestros copatrocinadores, muchas gracias. La señora Michael reflexionó un poquito sobre Iowa, porque ella es original, nació en Dubuque, por cierto, pero ella vive en Pensilvania, en Filadelfia, y ella reflexiona acerca del punto de que cuando muchos piensan en Iowa, alrededor del país, lo que piensan es como un ambiente sano, lleno de fincas, de granjas, de ranchos, de una vida muy sana. Sin embargo, Iowa tiene problemas serios con contaminación, sobre todo en ciertas zonas. También contaminación, por ejemplo, de plantas a base de carbono, que son una fuente de dióxido de carbono que contribuyen al cambio climático, que es otro tema, pero todo esto está interrelacionado. Y la polución en general. Entonces, es importante recordar que en Iowa se necesita legislación fuerte. All right, so let's bring us back to nature, Dr. Bartlett, to conclude this, because I believe you, in your medical practice, which is science-based, you actually regard nature as a source of health, and you prescribe it, as far as I understand. And one of the things that we're very, very concerned with at Moms Clean Air Force is the health of our planet. We are so tied up right now with the coronavirus. So busy, so distracted, and it is a huge crisis. At no moment does Moms Clean Air Force want to minimize that. It is really, first and foremost, what we need to deal with right now is the coronavirus crisis. Those of us who have the luxury of not having to survive from day to day are still also keeping in mind the bigger crisis, which will only magnify anything that is happening now. And that is the climate crisis, which, by the way, connects to pollution, because the same elements that contribute to the buildup of greenhouse gases that are giving our planet a fever that amplifies all these phenomena, the natural phenomena that then become catastrophic in very short sequence, are the same materials, chemical elements, and compounds that hurt us here and now in our everyday. So tell us about nature and why it's so important to protect nature, that this is not just some bucolic idea that some of us have and isn't that nice, but really, let's be practical. Let's talk about why nature is important in practical terms from all standpoints.
It's not bucolic at all. It is probably the most important thing. And as far as I'm concerned, we must put our planet's health number one, first and foremost, in even this conversation about coronavirus. Because if we don't start healing our planet, there's no point in trying to be healthier as human beings. And in fact, it's not possible to be healthy as human beings with such an unhealthy planet. So they go hand in hand in such a way that they're inextricably linked. And I think it's part of this destruction of the environment, the poor health of our people, this complete disconnection of all of these components that is contributing to the place that we're in today. And I'll pause.
Le pregunto a la doctora Bartlett por qué es importante abogar por la salud de nuestro planeta. La crisis del cambio climático es algo que le preocupa muchísimo a Moms Clean Air Force y a Comadres. Y los componentes a base de carbono que amplifican, que se convierten en gases de efecto invernadero y que básicamente generan un tipo de fiebre en la atmósfera de la Tierra, y que esta temperatura elevada causa que todos los fenómenos naturales se amplifiquen, se tornen catastróficos. Le pregunto a la doctora Bartlett, esos son los mismos componentes que además nos están afectando aquí y ahora en el suelo, es decir, las fábricas, las cosas que inhalamos son esos mismos componentes. Entonces es importante luchar contra la contaminación, simplemente, no solamente por el cambio climático, sino porque nos afecta la salud diaria. Y ella recalca que aún ahora, en medio del coronavirus, es súper importante pensar y abogar y luchar por la salud del planeta en general. Esto no es una cuestión idealista. Esto no es algo que algunos de nosotros nos damos el lujo de estar pensando de que, ay, qué bonito preocuparnos por la salud de la Tierra y de luchar contra el cambio climático. En realidad, el cambio climático es la crisis de salud más grande. Y si no nos preocupamos por eso, tiene muy poco sentido preocuparnos por lo que estamos viviendo en este momento y por nuestra salud en este momento. Las dos cosas van de la mano, y ella nos recuerda lo importante que es seguir abogando por la salud del planeta. Now, I would like to add, Dr. Bartlett, that of course, the same components that we're polluting our environment with, that are contributing to greenhouse gas buildup, those have decreased during the coronavirus crisis. Moms Clean Air Force is unequivocal in a statement that says a pandemic is not the way we want to fight for a cleaner earth, for a better, to fight against the climate crisis. But there are observations that you pointed out in your op-ed from Earth Day, which give us some hope, because there are also opportunities in this, wouldn't you say?
Absolutely, there are opportunities. What if we could learn from what's happening right now and the beautiful changes and the reduction of air pollution and water pollution that are happening right now? What if we could go outdoors in nature? Because what I'm seeing, I do prescribe nature, and I take people out in nature in a practice called forest bathing, of all things. And what I'm seeing and what I'm hearing from people right now is this deep longing for time outdoors that's happening to people who maybe don't typically think of time outdoors. But in this time of this great difficulty, it's a trauma to all of us, individually and collectively. And that trauma then creates mourning and grief. And when that occurs, people are drawn outside. It just happens. We are nature, and therefore we're drawn out to nature. And so I'm seeing this swelling of people being drawn outside for their own healing. So my hope is that then when people derive healing from nature, that will spill back in a reciprocal fashion, that we don't extract healing from nature, we participate in healing with nature.
Gracias, doctora. Una de las cosas que hemos observado durante el coronavirus es que se ha mejorado la calidad del aire y la calidad de problemas ambientales en muchos lugares. Sin embargo, en Moms Clean Air Force somos totalmente claros en el sentido de que una pandemia no es la solución para luchar contra un planeta más saludable. Para eso se requieren acciones, y esta crisis que estamos viviendo también nos ofrece oportunidades de recordar que la naturaleza es una fuente de salud y que vale la pena luchar por ello. Y ella incluso prescribe tiempo afuera como parte de su régimen de salud para las personas, sus pacientes. Y ella explica que en este momento, bajo estas circunstancias difíciles que nos están traumatizando a nivel individual, familiar o a nivel de comunidad, muchas personas han expresado una sensación de pérdida, una sensación de luto, que en gran medida se puede mejorar pasando tiempo en la naturaleza. Well, we've come pretty much to the end of our program. We've overstayed our welcome a little bit. Any final thoughts, or may I say my concluding words?
You may. Thank you so much for having me today. It's been a pleasure.
Can I give something before we?
Yes.
I would just want to say, because Dr. Bartlett wrote back in February an essay on her webpage that I would just want to quote the title and the notion of it is that the coronavirus is coming your way. Hug yourself to a tree. Agárrate de un árbol. And that has so many ways. It's not just because it's coming and you need to hold yourself from something, because a tree is going to help you. And I mean, it may be metaphorical, but it's real. Nature,
real.
trees will help you. So this is the time where we need to be more connected to nature. And as she said, it's not only, I mean, obviously you should go out to a park or a forest, but even if it's just a tree, even if it's just the plants like you, Karin, have behind you, that helps. That
Absolutely.
is very important, not to forget that nature is there for us. And we need to not reconnect with nature. Déjame decirlo ahora en español. La doctora Bartlett en un ensayo que escribió en febrero dijo, el coronavirus viene hacia nosotros. ¿Qué es lo que podemos hacer? Agárrate de un árbol. Y lo que quiere decir no es solamente que te agarres porque viene fuerte, sino que un árbol te va a ayudar. ¿Por qué? Porque la naturaleza, como ya se dijo, te ayuda en lo físico, en lo espiritual, en lo psicológico, en todos aspectos. Y ahora más que nunca tenemos que estar conectados o reconectados con la naturaleza. Es decir, si tenemos la oportunidad de salir a un parque o a un bosque, perfecto. Si no, el árbol que está fuera de nuestra casa, y si no, la plantita que está junto a nosotros. Todas esas maneras es bien importante de que convivamos y reconectemos con la naturaleza. La naturaleza está ahí para nosotros. Es cuestión de que nosotros estemos también presentes para ella. So I just wanted to stop with that because I know that's kind of our thing.
Absolutely. Those are wonderful final words. I would like to finish this program by thanking you all so much for joining us here today, and by sharing the screen with my contact information right here in Iowa, so you know exactly how to reach us. You will also see the website of the National Moms Clean Air Force page on the internet, which is a phenomenal resource of all kinds of information that you can use as a professional or as a community member. Voy a cerrar creo que tus palabras son precisas, excelentes para cerrar este programa. Voy a proyectar mi información de contacto al final para que las personas en Iowa sepan cómo contactarse con el programa de comadres y de Moms Clean Air Force. Y además, al fondo verán la página de internet de Moms Clean Air Force, que es una fuente de recursos increíble, tanto para profesionales como para gente que quiere ayudar a su comunidad y a su familia. Thank you so much. Thank you, Moms Clean Air Force. Thank you, Corazon Latino. Dr. Bartlett, from the bottom of our hearts, thank you for your time, for the important perspective and for the voice that you're giving Latinos in Iowa and other people who are disproportionately affected by the coronavirus in these difficult times. Thank you so much. Here is my contact information. Let's see if I can bring this up elegantly without crashing the system. And so this will be preserved on the Facebook page. This is how I can be reached in Iowa, but please also visit the national web page, which is a phenomenal source of information. Bueno, muchísimas gracias. Hasta luego, hasta la próxima, and let's just see if I can bring up again my Zoom meeting to get us out of here elegantly, which is always the challenge as to how to end these. Dr. Bartlett, while I find how to log out, what is the next step for you as a mother, as a community member, thinking of your children's future, what's most important for you and your children? And we'll conclude with that.
Wow, just keeping them gathered closely and trying for all of us to just stay sane and happy and get out a little bit every day.
Manténganse cercanos con sus familias, apóyenlos, manténganse saludables, contáctenos y que les vaya muy, muy bien en esta época. Cuídense mucho. Hasta luego.
Adiós.